Hello, my name is Kimberly Stetson. Today I will be presenting a logic model developed for the City of Everett, Washington. This model addresses key community health needs identified in prior assessments, including mental health challenges, substance use, and housing instability. Logic models are important tools in public health because they show how program inputs and activities lead to both short and long-term outcomes. They help guide planning and evaluation and provide a clear picture of how a program is designed to work. The City of Everett is facing several interconnected public health challenges, including mental health concerns, substance use, and housing instability. According to CDC data, mental health related emergency department visits remain high, indicating a strong need for behavioral health services. At the local level, opioid overdose deaths in Snohomish County have nearly doubled in recent years. Housing instability is also a major concern, with more than half of renters in Everett considered cost burdened. These challenges disproportionately affect vulnerable populations, especially low-income individuals and those experiencing homelessness. To address these needs, two action plans were developed. The first focuses on expanding behavioral health access, and the second focuses on improving community outreach and care coordination. Together, these plans aim to create a more integrated and accessible system of care. A logic model is a visual representation that shows the relationship between program, resources, activities, and outcomes. It helps explain how a program is expected to achieve its goals and provides a structured approach to planning and evaluation. According to public health guidance from sources like CDC and Community Toolbox, logic models also help simplify complex processes and improve communication with stakeholders. In this project, the logic model is used to guide the evaluation of the proposed action plans and ensure that each component contributes to meaningful, measurable outcomes. This slide shows the integrated logic model for behavioral health and community access initiatives in Everett. The model begins with key assets and inputs, such as community clinics, nonprofit organizations, funding, staffing, and behavioral health specialists. These resources support activities like outreach programs, mental health screenings, case management, and referral services. These activities lead to measurable outputs, such as the number of screenings completed, participants served, and referrals made. From there, the model moves into intermediate outcomes, including increased access to services, improved care coordination, and greater community awareness. Ultimately, these changes lead to long-term outcomes like reduced substance use, improved mental health outcomes, and increased housing stability. The components of this logic model were selected on evidence-based public health practices and the needs identified in the Everett community. The model emphasizes prevention, access to care, and collaboration across sectors, which are all important strategies for addressing mental health and substance use challenges. It also incorporates community partnerships to help ensure services are accessible, culturally appropriate, and responsive to the needs of the target population. Focusing on outreach and care coordination helps reduce barriers and makes it easier for individuals to access and navigate services. This logic model supports evaluation by identifying measurable outputs and outcomes that can be tracked over time. For example, increases in service utilization may indicate improved access to care, while reductions in emergency department visits may suggest that early intervention efforts are working effectively. The model also addresses upstream determinants of health by improving access to services and emphasizing prevention. These efforts support long-term improvements, including better mental health outcomes, reduced substance use, and increased housing stability, which directly address the community's greatest needs. The logic model is an important tool for engaging stakeholders and supporting program implementation. It clearly illustrates how the program works and what outcomes are expected, which help align goals among community organizations, funders, and policymakers. It also supports funding decisions by showing how resources are connected to measurable outcomes. Overall, the model promotes transparency, accountability, and collaboration, all of which are essential for long-term program success. This presentation is supported by credible sources, including the Centers for Disease Control and Prevention, the Community Toolbox, and local data from the City of Everett and Snohomish County Health Department. These sources provide evidence-based guidance on logic model development as well as relevant data on community health needs. All references that you see on this slide are in APA format. Thank you so much for taking time out of your day to listen to my presentation. Have a wonderful rest of your day.